Good morning, all. After a very successful session on Tuesday, where we focused on our collaboration between ECMWF and Union for the Mediterranean for applications on cultural heritage, we have a very interesting second session, which is focused on health in the Mediterranean. And for this, I have a very interesting panel, which I would like to introduce you after a few words from Gaminos. Gaminos, can you introduce what we're doing here today at the Mediterranean Pavilion?
Good morning, ladies and gentlemen. Let me start with saying something which is so obvious that it's needless to say. It is time for action. We cannot wait anymore. Climate change poses a lot of different threats, but some of these threats are kind of orphan in the media. Climate change has three kind of impacts, and the media only talks about one. They only talk about damages to infrastructures due to severe weather events. They forget that climate change is destabilizing because it randomizes nature cycles. With climate change, you don't know anymore when it's going to rain. So you don't know how to organize agriculture. You don't know how to organize your roads. And then they forget a third very important kind of impact, which is on human physiology. Heat waves do kill elderly people. And areas of transmissible diseases are enlarging or shifting. At this point, it does not emerge as the greatest threat, but it's going to be. So we have to do something about it. And then a weird friendship jumped in. I belong to the Union for the Mediterranean, which is you cannot imagine a more political organization. And as our friend Greta Thunberg says, political organizations are inclined to blah, blah, blah. We still believe that this blah, blah, blah is useful, but it has to be turned into action. This is why serendipity made us meet with Copernicus, especially the climate change program of Copernicus. And they have something we don't have, something that everybody is fighting about. Facebook is making a fortune out of it. It's data. Data is the new gold. But our friends, pass me this one, they're kind of naive because they give out this data for free. They could make a lot of money with it, but they just give it out for free. With one problem, it's data so elaborated that you need a lot of knowledge to interpret them. So we came together and we said, let us do something. We use our political convening power. You have all your knowledge. Let us make it something concrete for people. And that's how we start this venture. We will be publishing a website, which is a gateway to mobile apps, in which you can find practical information for stakeholders. A few days ago, we introduced the first one of these apps, which is about the protection of cultural heritage among the coastlines. Again, one thing that seems, you're in front of migrations. Well, is this important? Well, cultural heritage is who we are, and UNESCO tells us that 50% of cultural heritage is threatened by sea level rise. How many lives are threatened by the fact that vector-borne diseases are going into places where they are not well known? And if they're not well known, people do not know how to defend themselves. How many lives can be lost? In my opinion, a life is a life. It's more important than anything. So, as an organization, we are extremely proud and grateful to Copernicus to give us the means to become effective. In this field, we have other projects. We will be trying to give useful practical information in the field of energy, for instance. But, energy is important for development. And before development, before any of these values, a life is a life. So Let me just say, as UFM, I think that what we are trying to set up with Copernicus is possibly the most important thing that we could do. We try to save lives, and we are so grateful to Copernicus for doing this together.
Thanks a lot, Kraminos. These introductory words are very strong and a very good introduction of what we're going to hear, because what we're going to hear now is a session which really puts Copernicus, Earth observation data, in front of how it could work for the Mediterranean region if it comes to climate change and health impacts. And the discussion is driven by 4 different experts, each with their own background. First, we have Carlo Buontempo, Director of the Copernicus Climate Change Service. Welcome, Carlo. We have Linneo Mirvilli. Welcome, Linneo. She's a Senior Resilience Advisor and Chief Heat Officer of the city of Athens, but she's also working for the UN and the European Commission. Welcome. We have Richard Engelen, who is our Deputy Director for the Copernicus Atmosphere Monitoring Service. Welcome, Richard. And last but not least, and for this I have to go online. I hope we can see her. We also have Francesca De Donato, and she's working at the Department for Epidemiology at the Lazio Regional Health Service. Welcome.
Morning.
Good morning. Good to see you. So, let's start with our panel. The first question is for you, Carlo. Carlo, can you share with us what we are observing in the Mediterranean region in terms of climate situation? And can you focus on those impacts which are really important for the health situation?
Thank you, Stein, and thank you for the welcome. It's a pleasure to be here with you today. I won't take too much of your time, but I would like to start from what is fresh in our memory today. We have just been through the warmest October on record. We mentioned this a couple of days ago, and this warmest October on record came after the warmest summer on record. So you see on the map here, the map of the anomaly of temperature obtained by the Climate Change Service using the reanalysis product. And what you see is this red color spreading all over Europe. So when I received this bulletin that comes out every month at the end of August, before it was launched, I was surprised and a bit worried by it, because this record, the record breaking, comes after the last summer, which itself was record breaking. And the difference between the two was nearly half a degree, so really incredible. This is really the news of this summer, the news of this recent months, and unsurprisingly has been picked up widely by the media all over the Mediterranean, Europe, and the rest of the world. But if you do a step back, and what you see on the right are coming from the State of the Climate that we jointly produced with the World Meteorological Organization and was launched last week in Geneva, this refers to 2021. 2021 was different. There was a bit of a heat wave, but what really affected the fatalities, the vulnerability in Europe was the flooding in northwestern Europe that affected Germany, Belgium, part of the Netherlands, and so on. And what you see here is something that we didn't have before, is a breakdown of the events according to their category and their impact in terms of affected people, economic damages, and death, fatalities. So it's really not just the infrastructure, it's really the impact that it has on us. What you see here is that flooding that year was the most impactful of the event, but on a normal year are the heat waves, the one that kill us. The killer, among all the drivers, climate drivers, the heat waves are disproportionately affecting us. And this is something actually we know. Heat waves are getting more prevalent, more intense, longer. So what you see here is an extract of the State of the Climate report. We publish this every year in April. This is the 2022 version, so looking at 2021. And you see a number of indicators. Each one of those is provided openly and freely. Maybe we are unwise, as Grameno say, in making so much data available, but that's very much the core of the idea. All the data is open and free. You can use it as much as you like. And you see some indicators. So temperature we have talked about, increase in the greenhouse gases that is also having an impact on pollution and health in itself. Reduction in ice sheet and sea ice, glaciers melt, and so on. So the climate in Europe is changing in a dramatic way. How are we affected by it? Well, first and foremost by heat wave. We mentioned that. But we also know that for most of Europe, the intense precipitation is increasing. So the intensity of precipitation is increasing. We know that some of the weather patterns are changing. So all these things need to be taken on board coherently. We normally work on heat waves because that's the most is the greatest killer. But in this case, we try to do something slightly different. And at the end of this session, I will say a bit more about it. What we try to do generally is to map this huge amount of data we have on one side into something that is a bit easier to comprehend and use, responding to the challenge that Grameno set us. So we work with the expert of the Union of the Mediterranean. We worked with the health expert on the ground to transform that huge amount, petabyte of data, into few kilobytes of applications. So that's what we do with the state of the climate. That's what we do with the monthly bulletin. But that's also what we do with dedicated application. And in this case, and I will say something more about it later on, this is an application that maps the suitability, the climate suitability for a mosquito that is a vector for diseases. So more of it later. Thank you, Stein.
Thanks a lot, Carlo. So it's a very nice illustration of what the Copernicus Climate Change Service is offering, not only in terms of data and knowledge, but also as a service. Let's now move to Linneo. So you're both an expert at UN level, at European Commission level, so you're one of the experts on the mission of climate observation, and you're the chief heat officer of the city of Athens. So you're working both at international level, European level, and city level. It's quite unique. So we really would like to hear from you. If you look at things, what's needed at international level to city level, what in your opinion should we do to build our resilience to extreme heat?
So, as Carlos said, we are starting finally to focus on heat waves and heat especially in urban centers as one of the most critical challenges for taking lives of people, especially the most vulnerable populations. And these are deaths that we can avoid because we can put into effect policies and measures that can warn, like we can have an early warning system, we can have a categorization system of heat waves, we can have, based on Copernicus data, a way to understand the city based on the heat spots and the heat pressures of the city, based also on the type of land use and land cover, where, or for example, green canopy, where are the areas that we have to focus on and what kind of policies we have to implement to make sure that we protect the communities that are the ones that are the most vulnerable. So I'll start with an example. Not this summer, the summer before this one, in 2021, Athens had 2 heat waves. The second one was a very long one. It lasted more than 3 weeks. And it reached temperatures in Athens up to 45 degrees. And because of that, in the very beginning of it, because it was a very dry summer and very hot summer, we started immediately having peri-urban fires. And of course, the attention was on the fires, because indeed, it was a crazy summer that we lost, it was 30% more than what the average of the previous years for the loss of biodiversity and forests. But what was happening in Athens was something that was really the sky was red and brown, and not only did we have extraordinary temperatures, but we also had a lot of microparticle pollution. And so we had people, we were asked to stay indoors by the Ministry of Health, and also if we went out to wear masks, the masks that we wore for COVID. So thank God we all had the masks. But it really was, we couldn't breathe. I remember I wore the mask in order to be able to sleep at night, because I felt like it was my chest was burning when I was breathing. So in Athens, we have used Copernicus data to create, together with the National Observatory of Athens, an application that tells you your personalized risk in where you are in Athens, tells you on a map where to go to take cover. And in 2021, totally by chance, we had also added, based again on Copernicus data, the risk based on pollutants, on air quality. So we had, at that particular summer, we had red for temperature and red for pollution. So people, it's important for people to understand, because we still do not realize, I mean, a big challenge that we have is awareness raising. And of course, I mean, to answer your first question, what we really need, and I'll talk a little bit more, what we really need is data-driven policy making. Exactly because climate change is the most important thing that we have to deal with. Policymakers and decision makers have to seriously, all of the decisions that they make and the policies that they have to be data-driven now. And so Copernicus is like an incredible tool that we have, because it's free and it's open, and we've been using it in Athens. So the other thing that we did is we used the ERA 5 data, and we created, together with the Ars Rock Resilience Center, a very innovative categorization of heat waves that figured out, it backcasted, I can get into it later, but it backcasted what kind of temperatures sit on top of Athens specifically, and correlated meteorological data with mortality data. So we created a specific algorithm specific for Athens, and now we're forecasting, we have 3 categories, and we're forecasting based on specifically the risk on people's health is. So it's not just meteorological, but it's meteorological together with health, which helps a lot both for awareness raising, but also for policymakers to understand when they need to do what kind of measures to take for protection. And we also have, we did that in Athens and Seville did also the naming of heat waves. Both of these are important for awareness raising, because when we have a hurricane, and this is something that Inger liked, when we have a hurricane category 5, nobody thinks of ordering a pizza. But when we have a 45 degrees temperature in Athens, we stay in the house and call for people to bring us food. We don't think of the workers. We don't think of the people that, and also we don't think of we need to think of especially the older people that live alone. We know from the Red Cross that we work together with that 83% of the people that die in Athens are people that die alone in their homes. And that's a terrible, terrible piece of data. And the final thing that we use the Copernicus data, should I stop? I should go on. So one of the things that we are doing is we have discovered that together with the water and sewage company, that there is this incredible aqueduct which was built in 150, which links us back to the other session that you had, because it's a monument. It was built in the Roman years in 150 AD. And it's all underground, 23 kilometers. It was used to bring water into the center of the city. 23 kilometers, just amazing engineering feat. It just goes like slowly like this. And it still has, it moves amazing amounts of water, 1.5 million cubic meters of water that we throw into the sewage and into the sea. So now we are starting to do a strategic plan where, again, with the Ars Rock Resilience Center, we're doing guidelines for greening and using water and using permeable surfaces to cool, to make this whole green corridor that cools the city down. 8 different municipalities are collaborating. But we are linked it to Arsinoi, which is one of the big Horizon 2020 research that we're doing. And we're using Copernicus data for land use and land cover, for canopy cover, for the height of buildings, for, I've written it all down, for air temperatures, because we found the urban climate model. Somebody had actually studied Athens, so we can get air temperatures all around. So this is amazing, because we can really decide where it's more important to spend our little money so that it can have the maximum effect in building resilience, especially for the most vulnerable. Thank you.
Thank you very much for these insights. And I always like examples, because examples are so powerful to tell the story, a story which is really there to make sure that you can connect policy, data with real users. So thanks a lot for this information. And you also illustrated that it's a combination of factors. So it's population elements, it's climate change, of course, but then you also have the element of air pollution. And for this we have Richard here, of course, who is the best suited person here in the room to share a little bit about this. And Richard, climate change has several knock-on effects which influence also the air quality. So in a way it's all connected. So can you provide some examples from the Mediterranean region on how the Copernicus Atmosphere Monitoring Service provides added value to our users?
Yes, thank you, Stein. Well, what can I add actually after these excellent examples that we've heard about combining Copernicus data in different ways from different services, even to indeed help people. I'm very happy about it because this is exactly what we're doing, and indeed we might seem unwise by providing it all free and open, but I think Copernicus is a great example of how we bring together the expertise in Europe, generate the data, reliable data, accurate data, in support of the many environmental problems and challenges we have in Europe. So I'm really happy to listen to what you've presented. So I will go, if there's a presentation. Sorry? No slides. I'll talk, that's fine.
In the meantime, I would also like to invite the people outside to come in. There are some interested people on the outside of the window.
Here we go.
Ah, look, very good. Welcome. Yes, please come in, or you can go through the door, it's also easy.
All right, so the slides are up now. I wanted to show 3 examples of data that Copernicus provides through the Copernicus Atmosphere Monitoring Service. The Atmosphere Monitoring Service is focused on atmospheric composition, on air quality globally, but with a specific focus on Europe as well. And there's 3 examples I present here, and some of it has been named already actually, where there's a link between atmospheric composition and climate change as well. The first example is summer smog, high values of ozone close to the surface. And this is directly linked to heat waves. Ozone is a funny molecule. It's produced based on other pollutants that we emit in the atmosphere, but it also needs solar radiation to be formed near the surface. So it correlates directly with heat waves, where we have a lot of sunshine, also increased temperatures, we get higher ozone concentrations. And you can see this in the map here, where the more orange, the higher the ozone values are for that particular day. And of course, the Mediterranean area gets the highest concentrations that we see in Europe. Important is also to note that studies have now shown that the increased levels of ozone are as detrimental to health as increased temperatures. So we talk about heat waves, we talk about high temperatures, but it's not the whole story. It's also the pollution that's actually increased, and people suffer from that. And you already pointed that out. So within CAMS, the Atmosphere Monitoring Service, we monitor ozone on a daily basis. We also provide forecasts for the next 5 days within Europe. In the global, we actually go a little bit further. This data is all available. We keep all the data for the past years, so it's all available for studies, but also for warning systems. My next example is also already something that's been mentioned. It's the occurrence of wildfires. Again, there's a direct link to climate change with drier periods and increased wildfire activity. The figure is not as clear maybe, but it's 3 Mediterranean countries, Spain, Portugal and France, shown from left to right. The top is the amount of wildfire emissions in the country throughout this year. And the bottom in black is the annual mean of the annual total of emissions over the last decade or so. And you can already see that this year stands out, especially for Spain, a huge amount of wildfires, a huge amount of emissions. But also Greece was affected, and we see it all around the Mediterranean area. Here again, CAMS provides data. We monitor the fire emissions on a daily basis. We use satellite data to look where the fires are, and we use algorithms to then estimate how many emissions are resulting from these fires. This data is available again on a daily basis, but we also keep the data records going all the way back to 2003. Then my final example, if it lets me go. Yes, is the impact of desert dust, which heavily affects the Mediterranean area. We see these enormous plumes of desert dust coming from the Sahara Desert, being blown north. We see it in the springtime especially, but now, especially this year, we have seen a lot more than we normally see. It might be just within the natural variability, but there are studies now looking into the relationship between climate change and the occurrence of these plumes. We know that semi-arid zones are extending due to climate change, so this might have an impact on the dust. But it's a very significant phenomenon that affects air quality, but also visibility. It affects the economy, airports, and sometimes even traffic where you can't see anything. So this is an important thing that we do monitor. And again, here we monitor this on a daily basis. We provide forecasts every day for the coming week about where the dust is going, and helping people to be aware of what's coming their way. So these are the 3 examples that I wanted to show. There's a lot more within the atmosphere monitoring service that we provide, and similar to what Carlos said, the data is all available through data platforms we have. And again, I was really happy to see these excellent examples of how data is actually being used, because that's in the end what we want. We do our best to provide the accurate data, but then we need people to actually use that data to help us in the various environmental challenges.
Thanks a lot, Richard. And again, it's a very nice example on how data-driven elements are really showing potential impacts on health. So now we were talking about ozone, we were talking about wildfires, we were talking about desert storms, and of course this impacts the whole region. So it's not only the northern part of the Mediterranean, but also the southern part, and it's true that this knowledge can be used for the whole region as such, and that integrated solutions are often those which we really need to serve the people of the region. So after talking about policy, after talking about concrete examples on the ground and what the 2 services, the climate change service and atmosphere service, are providing, I now want to go to Italy, to the Lazio region. And I don't know, Francesca, if you're based in Rome itself.
Yes, I am.
Okay, so hello from Rome. I hope you can hear us well.
Yes, I can hear you very well. Can you hear me?
Yes, we can hear you very well.
Great.
So welcome again. So Francesca, so we discussed the importance of climate and atmosphere data in support of the public health sector. So how does this data links with vulnerability assessments and evaluation on how climate impacts change? And do you have maybe some examples on how this data is used in European projects and in the Italian heat adaptation plan?
Yes, thanks very much for the introduction, and it's great to be here with you all today. Yeah, environmental data is extremely important in public health for two main reasons. Firstly, obviously, and foremost for epidemiological research to estimate the health risks and the impacts, but also to identify vulnerability factors of the local population, either be it by where they live, if they're more exposed to a specific environmental risk, if they're more exposed to heat waves, to air pollution, or to other factors, but also in terms of the characteristics of the population when we are planning and implementing adaptation and response measures. If we think of adaptation to climate change, data is important not only to know the current situation, but also future impacts and where we need to really focus the resources. And then if we think of extreme weather events like that have been mentioned before, like heat waves, for example, but also flooding and other environmental exposures, it's really important to have the necessary data to plan prevention measures, response and resilience of the health system as well, not only of the local population. So thinking of this aspect of public health, I have a couple of slides just to give you a few examples of what we've been doing in European projects. I hope you can see my slides. Can you see my slides? I don't know if you can see them because I can't hear you.
Yes, we can see it, Francesca.
Okay, yeah. Great, thank you, thanks very much. So the first example I wanted to show was results from a European project called Exhaustion, in which doesn't only focus on the Mediterranean, but looks at the effects of heat and air pollution on cardiopulmonary disease specifically. So focusing on what the impacts are and how we can improve prevention and response to these exposures. We all know, it's quite well known in the epidemiological and public health world, but I think it's quite well known beyond that heat and exposure to extreme temperatures are a risk factor for the population, but so are air pollutants and being exposed to PM, nitrogen dioxide, for example, or ozone as well, have health effects in different subgroups of the population, but they are more often than not studied separately. So we don't really know what their combined effect is. And as we think of people living in cities or industrialized areas, we're not only exposed to temperatures, we're contemporarily exposed to air pollution as well. So further research was needed in looking at the interactive effect of when we're exposed to both these pollutants. So within the Exhaustion project, we not only used observed data, which was available from over 150 cities, and these are the combined results that you can see in the graph, which I'll explain shortly, but we also used model data available from Copernicus, from ECMWF, looking at which enabled us not only to give very high resolution estimates within cities, focusing on cohort studies and looking at differences in exposure within a city for air pollution and temperatures, but also providing national estimates, having, for example, ERA5 data or data available from CAMS and satellite data, which were used to provide new models and very sophisticated exposure estimates that gave us not only an estimate at national level, but also on rural and suburban areas, which we don't know so much about because data monitors are more often than not within cities. So having modeled data that provides characteristics across the whole of the European context really is useful for planning and prevention measures within the public health sector, because we have a real clear picture of what the impacts are in these different areas, and we can really focus on introducing measures, awareness and prevention where the problem is greatest. So just to summarize what this graph shows, essentially what we found was that when we're exposed to high temperatures, we see a greater increase in mortality when we're also exposed to high levels of air pollution, both for PM10 and for ozone. In this case, the graph shows cardiovascular disease and respiratory disease. And as you can see with the red squares, when we're exposed to high levels of these pollutants, the effect and the percent increase in mortality is much higher when we're in terms of both cardiovascular and respiratory disease. And this is a really interesting finding because it means that we not only know the levels of exposure when we need to introduce warnings and increase response measures and emergency programs, but also who the people most at risk are and for their health characteristics. So this really goes in the direction of improving adaptation to these responses. And again, Europe is one of the most hit areas. We know of climate change, especially the Mediterranean area, which is exposed, as we saw from the previous presentations, not only to an increase in temperatures, which is going to be one of the highest across the globe, but also to air pollution, wildfires, droughts, and a whole series of concomitant conditions, which means that the population will be more vulnerable. And we need to respond to this in a more cohesive way. The second example I want to show is the use of data, again, when we're carrying out prevention measures, surveillance and monitoring. In Italy, we have a heat adaptation plan, which was devised by the Ministry of Health and Civil Protection in response to the 2003 heat wave. So it's been operational for quite a while now. And then each region has its own plan. And again, each city then has more specific actions put in place. So it's not only important to monitor how things are going on. We have a warning system that is in place, which considers exposure, so levels of temperatures and heat waves, but also the response in terms of health, as was described in one by the colleague before. But what is really important and relevant is the evaluation of the measures we put in place to make sure we keep improving what is introduced and really target those vulnerable people most at risk. We know it's not only the elderly, it's not only people who are more frail because of their health conditions, it's also pregnant women, outdoor workers, and a whole series of other people that really need to have targeted prevention measures. And this is what public health is really narrowing down to. What you can see here are the results from the summer 2022 heat wave, which Carlo described previously as well. It was one of the hottest summers on record. At European level, there was a temperature anomaly of over 1.3 degrees. In Italy and the Mediterranean, and as you can see from the map reported here, was one of the hottest areas again, so we're always more exposed than others. In Italy, temperatures were over 2.3 degrees above the climatological summer average. So we really were exposed to heat in a significant way. But the interesting result, again, is what we did, an evaluation of what happened in terms of population response and impact. And you can see on the right-hand side, the mortality risk curves in relation to apparent temperature, which is a combined indicator of temperature and humidity. And what we can see is that in the recent years, even if we had a COVID pandemic, which again puts population susceptibility at a higher level, we saw a reduction in the impacts of extreme temperatures. So even if this summer was really, really hot, the impacts on mortality and population were slightly lower, which suggests that the heat adaptation plan and all the measures put in place are actually working. And this is a positive incentive for public health introduction measures and what we need to be doing and how we can enhance this. So the continuous monitoring of what is happening and how things change over time because of population susceptibility, because of the climatological conditions and climate change is really relevant to make sure that we keep in pace with what is going on, and we adjust and adapt our resilience and our adaptation plans. And that is it from me. Thank you.
Thanks a lot, Francesca. And I hope you can stay tuned for the rest of the session. With this, I would like to close the panel. Thanks a lot, Francesca, for this presentation. So we had Francesca Di Donato from the Department of Epidemiology of the Lazio region. We had Richard England from ECMWF, Deputy Director of the Copernicus Atmosphere Monitoring Service. We had Linneo Mirivilli, Senior Resilience Advisor and Chief Heat Officer of the City of Athens. And last but not least, we also had Carlo Buontempo, Director of the Copernicus Climate Change Service. And with this, I would also like to give you the floor again, Carlo, because we have developed an application in partnership with the Union for the Mediterranean, and we would like to show it as an example on how we can provide tailor-made solutions for a certain region or for a certain challenge. Carlo, the floor is yours.
Thank you, Stein. And this goes very much in the direction of what Gramenos was saying in his introduction, in the sense that it's not just it's not sufficient to have good quality data produced operationally. You also need to make it usable, to translate it, to link it to policymaker and so on. So what we have done in this case is to link to something related to temperature. We have heard we had a warmest summer on record, but we also heard that Europe has warmed and the Mediterranean have warmed faster in recent decades than any other region in the world, excluding the Arctic. So that puts this region in a bit of a hotspot. So what you're seeing here is an application that look at the climate suitability for a specific kind of mosquito, the one that is known as a tiger mosquito. The Latin name is Aedo albopictus. This actually is a mosquito that wasn't endemic in the Mediterranean and is becoming endemic. It's coming, because of trading, it's coming from Southeast Asia, as spread widely. And it's a mosquito that is a vector for diseases such as dengue or chikungunya. And these are diseases that were not present in the Mediterranean and are becoming present. There have been cases reported in Italy and in France because of this mosquito. So what we have done here has been to build an interface that is entirely open and free. You can see what how is done is based on open and free data that maps the suitability of the mosquitoes. So what you see there, you can click on different emission scenario and you can see how the suitability and the length of the season over which that mosquito can live is changing over time. You can also click on your favorite location, and in that location you can see the evolution of the risk over time. And something I like well, there are not many things I like of climate change, but something I like of climate in general is the fact that it tends to surprise you. And for instance, when you're looking at the risk of mosquitoes, the risk is not going up everywhere in the same way. Actually, in some region, in the northern part of the basin especially, the risk may be going down. And the risk is going, or to say better, the suitability is going down, and it's going down because the temperature are becoming so extreme to reach a limit of suitability for mosquitoes. So there is likely to be an adaptation of the mosquito itself, as shown. This kind of mosquito is shown to be very adaptable to new climate conditions. So this doesn't necessarily translate immediately in a reduced risk, but certainly is an interesting finding. And what is particularly interesting is the fact that it's interactive and free. And if you want to play with it, there are videos outside that shows how the application works, and there are links, so you can use it. Is up there on the cloud and open and free. Thank you.
Thanks a lot, Carlo. And indeed, I would like to invite everyone to go outside and play with the different applications. There are iPads where you can play with, and there are some videos if you want to know more. But before we close, I would like to give the floor to the audience or to other speakers to ask questions. We have still 10 minutes left, so take your time to ask questions. I'm sure there are several. Who wants to ask the first question? Yeah.
I want to ask a couple of things. One is, we read the report that said that Europe is heating up almost twice as fast as the rest of the world on average. How does the Mediterranean compare to that? Like, where are we in relation with the rest of Europe? So that's one question. Secondly, now that I'm starting to step into the UN Habitat, I'm wondering, there is an incredible lack of data for, let's say, African countries and cities, especially more granular data like we have in Europe. Is there any chance that we can have a similar kind of, from the EU, something with data that is more inclusive for other countries that do not have such data? And finally, except for mosquitoes, do you also look at diseases that, do you also follow with this thing, diseases that hit trees? Because we have this terrible beetle that is eating up all our mulberries in Athens. And the mulberries are a really important tree for us for lowering temperatures. So this are my 3 questions. But
Thank you for the question. I think that I have enough for the next couple of hours now. I'll try to be concise. The first question, I learned over time that I need to be careful when I don't have the data in front of me to give answers. So I don't have an exact data about the Mediterranean. I can look into it. It's certainly one of the warmest, the fastest warming region, but I don't know the ranking nor the exact number. My Gramenos may have the figure in his mind. Do you?
No, actually, your first question is why does this pavilion exist? We're the second fastest warming region in the world. The waters of the Mediterranean are the fastest warming in the world. These measurements come with projected impacts of all kinds, which are very threatening, besides what might happen to the health of people. It means very quick salinization of the coastal lands, which means jeopardizing agriculture. It means, for instance, in this country, that the delta of the Nile could be salinized very quickly, jeopardizing the food security of a whole. We project 250 million people in water scarcity in a relatively short period. But this is the climate part of the story. The impact part is much more complicated. That is, since we are an asymmetric region, it means that we're not very integrated. It's a place where we have rich and poor and things like that. All this can easily turn into destabilization, which is not only a regional problem, it becomes also a global problem, because this is where three continents converge and their interests converge. It's Asia, Europe, and Africa that converge here. So we have various estimates on temperature. I remember some of them, but I don't think this is interesting. But the juice is not only we are the second fastest warming, but probably we are the most dangerous geostrategic hotspot for climate change in the world. In other places it's happening in a more dramatic way, like the desertification band over the Sahel. The human impacts are more dramatic, but from the point of view of global balances, what can happen here is geostrategically really delicate. Sorry, I didn't want to take too much.
But I was going to say, for Europe we know it's roughly 0.5 degrees per decade. I don't think the Mediterranean is much different. It's slightly higher than that. That's my preconceived idea, but I don't have an exact figure I can offer. On data, I think this is the right COP to talk about data, because it's really the topic. And there is this effort towards a global goal on observation and on data. And the Global South in general has less data and is losing network at the moment. So there is certainly this need. And I think part of that requirement also at the WMO level, at the World Meteorological Organization, is recognized with initiatives such as SOF on financing observation. But even there, I think there is some good news. And for instance, the fact that now, while suboptimal, we do have a global coverage through reanalysis, which offer a proxy in the absence of other observation on what is on the ground. I think it is a good news. So even if in a region where we don't have a stack station, we do have nonetheless an estimate of the condition in that location. The third point was about beetles and in general pathogens beyond humans. We've done a little bit of work, but I think what is important to stress here is that the idea is to free the data, make the data available, and provide tools that can be exploited to interrogate the data. So as we have done for the Union of the Mediterranean, for the vector-borne diseases, the same can be done for any other vector or any other kind of diseases. And there is a thriving community of organization and private company who can jump on that and develop their own application for the ash dieback or the chestnuts, or I mean there are many of those trees that are suffering at the moment.
Thank you for the questions. Are there other questions in the audience? Yes.
Thank you. I actually had a question for Francesca. I don't know if she's still online, but she mentioned health adaptation plans. I was wondering whether she could give us more information about how they are implemented in practice and what is working and what isn't.
Yes, hi, thank you for the question. Sorry, I can't see you, but I heard the question well. Yeah, in terms of adaptation plans, they are extremely important. I mean, I think both the research and funding and policy is really moving forward in terms of having an active role of the health sector and public health adaptation. There's several events going on in the coming days, again in the health pavilion, in the WHO pavilion, if you want to assist on this aspect, which really tries to focus on what is going on in terms of climate change adaptation and heat plans specifically. But the idea is obviously that the different components within an adaptation plan, which should not only be in terms of health or one specific sector. The idea is that they need, you need an interdisciplinary group of people. You need access to warning systems and health data. You need the emergency response teams and institutions. You need health professionals. It's an overarching domain. What we've seen in heat adaptation plans, I mean, I've worked on the WHO European guidance and updated evidence on heat adaptation plans. And what we saw is that after 2003, there has been an effort to introduce heat adaptation plans, which is still not over, comprehensive and complete across Europe. But there is some indication of what is really working, raising awareness, as was mentioned before, identifying vulnerable groups specifically. So not just saying it's the elderly, it's these other groups. So really matching and engaging with the research and transferring it into public health action. So what measures are done during heat waves towards the elderly, for example? You should check on them by GPs or social and health services. This is what we do in Italy, for example. We have emergency call lines you can call and access services. People can be referred to elderly homes or to hospitals if needed. But even just checking up on people and providing the base necessities of water, food, medication can really help reduce the impacts. But again, it's awareness, and it's very different. If you think of workers and outdoor workers, it's a completely different population. You need to have specific actions targeted to that. Another crucial aspect is monitoring of the health impacts constantly. So looking at how hospital admissions data change during heat waves, to understand who is most at risk where things are changing, if you need to introduce emergency response plans. It's a whole series of different things that need to be interlinked and connected in a formal plan. And in that way, the idea is that you can really respond and become more resilient to exposure to extreme heat, for example, but it can be applied to other exposures as well. It's the same framework. And the idea is combining the same framework within climate change adaptation. They can't all be siloed, as we've heard several times, right? So that's the key aspect. So what works essentially is the combination of the different actions. And again, these should be targeted to what the reality is on the ground and in a specific region. It's not one system for all. We know that Europe is very diverse, and if we extend it to the global region, it's even more so. But policies are national, they're regional, they're local, and all these need to work together. So if in some areas it's more of a social service response, that's fine. If it's more of a public health or civil protection response, that's fine as well. It depends on what is already on the ground, what works, and what people are used to, and how you need to understand the culture of it as well. So it's different aspects together.
Thanks a lot. Before we close, I have two questions myself, if I may. One question for Richard and Carlo, and one question for Gramenos. My first question to Richard and Carlo is, we have seen that Copernicus can provide a lot of data. The data is there, and of course you need to fine-tune some things, but we've seen that there's data on climate change, there's information on atmosphere. We have heard about the use of data from the land service. We have heard the link with the emergency service. How can you as Copernicus make sure that all the users which are interested in the theme of public health are served together? So is there an initiative which facilitates this? That's the question for the both of you. And then for Gramenos, you said, well, you talk data. You know very well what this means. I know what politicians need. So how can we bridge this? What do you think are potential needs in terms of capacity building, in terms of training, which could help to make sure that the data is really actionable and that we achieve this data-driven policies? Yeah.
Well, thank you for the question, Stein. So yes, a very important aspect. So far, a lot of the data portals for Copernicus are based on the individual services, so the atmosphere data store, the climate data store, the Sentinel data hub, etc., etc. So it's sometimes difficult to find the information, especially across services. So within the second phase of Copernicus, we have a new idea that we are now implementing, which are thematic hubs on specific themes that are relevant for our environmental monitoring. And one of the first ones is actually thematic hub on health, where the whole idea is to bring together the information that's relevant for health aspects based on Copernicus data from all the services in one portal. It's not that the data is all going to be moved to another portal. It's more an interface, but it makes sure that it's easy to access the data that you're interested in across the various services. So we really hope this will help people who need the data on the different themes. So health is one of the first, but there will be many more that they can find more directly the data they need.
Thank you, Richard. Carlo?
Just to add very briefly that we are following the example of CAMS within C3S by doing exactly the same, not for health, but for energy. So having just one entry point for information about energy that is becoming so important nowadays in Europe, that we are moving towards a larger fraction of renewable, and so the connection with climate is becoming more important than ever. So exactly the same is happening there. Thank you.
Thank you both. And maybe you both have an answer to my question?
No, okay. First, let me reinterpret for you Steen's question. Steen's question is, well, how can we do? No, actually, what he was telling me is, Dan, in your introduction, you forgot to mention that we are not only delivering an app, but we are also going to organize stakeholder seminars to try and understand what people need. That was, but unfortunately, he put something very important on the table. My personal life is not interesting, but during 4 years, among other things, I am originally an Italian diplomat. I held the most difficult job you could possibly imagine, which is head of the science policy interface with the government for environment. And I learned one thing. There are two separate worlds. One is what politicians want to do. And by the way, it's not their will, it's the will of the voters. Politicians want to declare that they will do what most of the voters want them to say. And then there is another universe which is called the truth, what you really need to do. And sometimes these two universes start to talk endlessly, one to the other. There is only one way to stop this useless conversation, which is data. Shut up.
Wow. So, this is a very important question. And I want to give a shout out to all of the mediators that speak between the two worlds of the scientists and the producers of data and the politicians and the decision makers and policy makers, the translators. The translators who understand both worlds and can explain and can make data relevant to policymakers are really important. And I want to here say the name of my friend Ifigenia Keramitsoglu, who's been my reference point. We did together the app with all the data, and whenever I have a question, I call her up. Like I called her before this session, and she explained to me all this stuff and how we've been using things. And if I want, and I just want to say how important this is. Some scientists really care about the social side of the science and the policy making, and we need them really badly. We really need the translator scientists. Thank you.
I can't imagine a nicer way to close this session, to be honest. So Thank you all for contributing. I would give ourselves a good applause. Thank you, Francesca from Rome. Thank you for your contributions.
Thank you.
I would say let's go out. The heat is building up in this small cube, and let's have a look at the videos. Let's have a look at the application, and I wish you a very nice continuation of the COP. Thank you.